I realized that we have to start from the beginning. And so we're going to be talking about navigating your healthcare first. So I won't be talking about specific diseases or chronic conditions. I'll just be talking about how to get through that visit, how to choose your doctor, how to interpret the things that they're telling you, what kind of questions to ask, and things like that, okay? So first off, I'm going to start with a prayer. And after that, I'm going to tell you a proverb. So, Lord, bless us all here this morning. May the words of my mouth and the meditation of my heart be acceptable in your sight. Oh Lord, you are my strength and my Redeemer. Lord, may a word that I say touch someone, just even if it's just one person, and help them to be able to navigate their health care better. In Jesus' name, amen. Amen. So the proverb that I want to share with you is, we are blessed to be a blessing. Amen. Wow. Now, I didn't say that it came out of Proverbs, like the Bible. It's a proverb because a proverb is a short, concise saying stating a general truth or a piece of advice. Yeah. Okay, this is the proverb that we, the Fleming family, live our lives by. We are blessed, and because the Lord blesses us, we need to bless others. Okay, and that means sometimes with your talents, it means with your money, it means with your time, but because we are blessed, we need to be a blessing to others. I have that as my email signature, so whenever I send out an email to someone, it says, blessed to be a blessing. Likewise, we have a scripture that exemplifies how our family lives and ministers to others. I am going to try to read it. My copy is a little bit too small. It comes from the book of Isaiah. Isaiah 58, chapter 58, verses 9 through 12. I'm going to start, though, at verse 6. And this is the Message version. And I purposely chose this version because it's the way we speak. This is the kind of fast day I'm after, to break the chains of injustice, get rid of exploitation in the workplace, free the oppressed, cancel debts. What I'm interested in seeing you do is sharing your food with the hungry, inviting the homeless poor into your homes, putting clothes on the shivering ill-clad, being available to your own families. Do this and the lights will turn on, and your lives will turn around at once. Your righteousness will pave the way. The God of glory will secure your passage. Then when you pray, God will answer. You'll call out for help, and I'll say, here I am. And this is the 9 through 12. If you get rid of unfair practices, quit blaming victims, quit gossiping about other people's sins. If you're generous with the hungry and start giving yourselves to the down and out, your lives will begin to glow in the darkness. Your shadowed lives will be bathed in sunlight. I will always show you where to go. I will give you a full life in the emptiest of places, firm muscles, strong bones. You will be like a well-watered garden, a gurgling spring that never runs dry. You'll use the old rubble of past lives to build anew, rebuild the foundations from out of your past. You'll be known as those who can fix anything, restore old ruins, rebuild and renovate, make the community livable again. So that's me in proverb and scripture. Short introduction. We live our lives by God first, family second, everything else is third. God first, I was saved at age 15, and a friend invited me to a youth revival. So there's something about just inviting somebody to church, okay? I eventually became a youth leader for all of Northern California for the AME Church. Now I'm a church planner's wife and a mother. Family, I'm married to Reverend Curtis Fleming. We have 7 children. We have 16 grandchildren. We are a clan. My two youngest are here, Ephraim and Jonas. And then the third, everything else, that's what people kind of focus on. I am a medical doctor. I always say medical doctor because you can get doctorates in education, in philosophy, in psychology, in almost anything. So I say medical doctor or I say physician because I want you to be clear what I am, okay? That's what I am now. Other labels I've carried is college dropout. I started undergrad straight out of high school and I dropped out for 6 years. I'm saying that because it's never too late. Don't let anyone discourage you. If it's for you, you'll get it, okay? I went to medical school at Creighton University School of Medicine, that's in Omaha, Nebraska. And I am residency trained in internal medicine and pediatrics at the University of Missouri, Kansas City. Right now, I am practicing internal medicine only at the Veterans Administration. So I'm going to get right into the doctor-patient relationship, okay? The first thing that we need to know is there's 3 different models of the doctor-patient relationship. There's what's called an active-passive model, a guidance cooperation model, and a mutual participation model. Healing won't work without a relationship. So I'm saying doctor-patient, but I need to insert in here, it could be provider-patient, because insurance companies and corporations that run medical facilities have designated us all as providers now. And that is because everyone is not medical school and residency trained. There are nurse practitioners and there are physician's assistants. And at the VA, actually, pharmacists do some patient care. So whoever that practitioner is, you need to have a relationship with them in order for it to work. But you need to decide what kind. So the first kind, the active-passive model, I'll go ahead and read it. The active-passive model is the oldest of the 3 models. It's based on the physician acting upon the patient who is treated as an inanimate object. The model may be appropriate during emergency, when the patient may be unconscious, or when delay in treatment may cause irreparable harm. In such situations, consent and complicated conversations are avoided, or is waived. So in my opinion, this should only be the model in case of emergency. So if you have a doctor who's not treating you as a person, who is acting on you and talking at you and not to you, then that's probably not the person for you. So you shouldn't see this in an office situation at all. The next type is called guidance cooperation model. So in this model, and I call it parental or paternal, the doctor is placed in a position of power due to having the medical knowledge that the patient lacks. The doctor is expected to decide what's in the patient's best interest, makes the recommendations. The patient then is expected to comply with these recommendations. So do as I say. Some people want this kind of relationship with their doctor. Some people just, they want to be absolved of having to make a decision. They say, you decide, you're the one who went to medical school. But there's another model that I like and that I use that I think is the most effective. It's a partnership and it's empowering for the patient. And it's called the mutual participation model. And it's an equal partnership between the doctor and the patient. The patient is viewed as the expert in their own life because you know more about you than anybody else. And then the physician's role is to find out what the patient's goals are, help them achieve the goals, and you guys work together in order to have the most healthy outcome. And it sometimes takes finding 2 or 3 different doctors before you find someone who you can relate to, who you can trust, who you can who you can allow into your front row. Okay? So we're going to the doctor, okay? We've established this relationship. During the medical visit, diagnosis and plans are made. We find out whether compliance is going to be happening, whether healing is going to happen. We provide support. We gather data. So all of that involves vulnerability and trust, which goes right back to that relationship, okay? There are several different appointment types. So you call the office, and it might be a virtual visit at this point, because COVID-19 has changed a few things. Yes. And we have found in healthcare that we can actually effectively treat a lot of medical conditions without actually touching you and being in the same room. So different appointment types are an acute concern, where you're sick or injured or you have a new symptom. Episodic, I call that the follow-up visit, where you're just following up on your diabetes or your high blood pressure. Or the physical exam. Everybody thinks they need a physical every year. You gotta have your yearly physical. Doctor, I'm here for my physical. That includes the well child check, the school physical, the sports physical, or just that annual exam. Also, at this point, we're doing those virtually too. In that case, I think ideally is in person. So let's talk about the acute concern. So you wake up and you have cold symptoms that you've already tried to treat yourself, and you think you have a sinus infection. That's the acute visit. That's the kind of thing that happens. Or you're injured, you sprained your ankle when you were on your daily walk. Or you have a new symptom where you just, every time you eat cashews, you get diarrhea. And you want someone to check on that. So those visits are problem focused. So the history is focused on what the symptom is that you are presenting. The exam is going to be focused on the symptom that you're presenting. So you might not get that head to toe exam. They might just touch your stomach because you're saying you're having diarrhea and nausea. So, and I say this because a lot of times if a patient leaves the office and they don't have a prescription in their hand, they think that nothing happened. That's right. Okay? So I'm saying some of what is happening is you presenting that history and the doctor calling on the wealth of knowledge to do a diagnosis and coming up with a treatment plan that may not include a medication. The episodic visit is similar as to the acute concern because the exam is usually focused or minimal, almost always heart and lungs, because most of the episodic visits are due to diabetes and high blood pressure and I call those the bread and butter diagnoses of medicine. We have diabetes, we have high blood pressure, we have high cholesterol. And when you lump those together, what you have is a recipe for heart disease, which is the #1 killer in this country. Heart disease.
You said the three that combine together.
Oh, hypertension, high blood pressure,
Okay.
diabetes,
Okay.
and high cholesterol.
High cholesterol. Okay.
Right. And if you add to those two things family history
Uh-huh.
and smoking, then you have the 5 major risk factors for heart disease.
Okay.
Okay. So let's talk about the physical. The physical is often a free visit. I'm calling it free because a lot of health insurance plans, you have to pay a copay when you come for your regular office visit. Most insurances allow you 1 exam a year. for a physical. So that's the reason I'm calling it free. The physical is actually more history than physical. So in medicine, we call it the history and physical, but we don't say that when you're making an appointment. So if you wonder, like, why is this doctor sitting here asking me all these questions, it's because about 90% of the diagnosis for almost anything can be taken from the history. And then the exam is just that gravy or icing on top. So we have past medical history. So the doctor is going to ask you, what have you already been diagnosed with? What medications are you taking? What has somebody told you that you already have? And same with surgical history. What kind of surgical procedures have you undergone? And sometimes you have to think back to childhood. But, oh yeah, I don't have my tonsils anymore. Yeah, I was in the hospital for emergency appendix surgery when I was a teenager. So sometimes it takes thinking back. The good thing is once it's in your medical history at that particular office, they shouldn't have to ask you about it again because it's in there. Family history is important. It's important because heart disease runs in family. And if you had a parent, mother in her 50s, father in his 60s, who had a heart attack, then that puts you at extra risk for heart disease. There's cancers that run in families like colon cancer, breast cancer. So we ask about family history. And I usually just say, what kind of things run in your family? Mother, father, sisters, brothers. And I say that because we all have a cousin or somebody far off that had something, but it doesn't have as much significance to our health as the mother, father, sister, brothers, or children, which are considered first-degree relatives. And then there's the social history. We ask about tobacco use, and that's because it's a risk factor for heart disease. We ask about alcohol because it can do a lot of things to you. It can change your blood pressure. It can affect your liver. It can affect your kidneys. It can cause depression. It can cause insomnia. So we're going to ask. And if you don't have that doctor-patient relationship and that trust, you're not going to tell the truth. And if you don't tell the truth, then the doctor can't help you. So it all comes back to forming the relationship. We ask about drug use, and then we ask about other things like, what's your marital status? Do you have kids? How much sleep are you getting each night? Do you exercise? What's your diet like? So all of that is before they even take out the stethoscope to touch you, okay? Then you get to the physical part of the physical. Usually it's head to toe. I've been told that some doctors are not doing this anymore, but usually it's head to toe. So this includes the well child visit. If you think back, or if you still have infants, toddlers, children, there is a well child visit at 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months. So you feel like you're always taking that child to the doctor. And then they're every year after age 2. There's the sports physical, because the athletics want to know that you're not likely to drop dead on the football field. So they require a physical, and they check for hernias as well, because there's a lot of exertion in some of the sports. Sometimes you need a physical for work. A lot of times they really just want blood work, but they want to know that you're generally healthy. And sometimes you need a physical before you undergo an operation, the preoperative physical. The exception is Medicare. So when you get to Medicare, age 65 or older, or disability, Medicare has what they call the annual wellness visit. Ironically, they do not include a physical exam in that visit. But it is a very important exam because that's your free chance to get your lab work, to get your screenings, to get just the things that you need annually. And with Medicare, because you have to often purchase a second part, then you want to take advantage of that free annual wellness visit. And don't fret so much about the doctor didn't touch me, because most of the time, if you have an acute thing, the doctor will at least look at that for you anyway. Yes, sir?
Can you explain that second part? I know I heard somebody say at one point there's like a plan B.
Yes.
And we have to have it because it doesn't cover everything.
Right.
And we have some seniors, and I'm quite sure across the
Yeah.
nation. Can you just give us a little insight on that, please?
All right. So Medicare Part A is the one that pays for your doctor visit, hospitalization, sometimes like nursing home and things like that. The Part B, you have to have, because Part A doesn't have pharmacy coverage, like for medication.
Okay. All right. Thank you.
So you need that second part. And often you can get the second part through Medicaid, depending on your income, or you purchase it, or you can have it through your employer. So, does that answer? Okay. So the screening part and preventive health care is what goes on during that annual physical and ongoing, because sometimes we don't catch you for our annual. And I found in my previous practices, especially with male patients, that I had to catch them while they were there. So they came because they had tennis elbow and they couldn't play tennis anymore. And I had to take that time and say, okay, well, let's talk about your immunizations. Let's screen you for heart disease. Let's see how you're living besides playing tennis. So sometimes it's not as simple as putting things in boxes. We can't just say, oh, nope, this visit is for this. There are doctors who will do that. And that's because their time is probably not their own, and they're overtaxed and overwhelmed, and they want to limit you. And sometimes it's not in their control, and sometimes it is. It probably takes a couple of visits to assess whether that's their personality or if that's the system that they're working under. Briefly, the immunizations that we talk about in visits. So for adults, we talk about tetanus. And tetanus is like when you step on a rusty nail or you cut yourself, you want to make sure you don't get lockjaw. A tetanus vaccine is every 10 years. Now, in 2005, I believe, there was an epidemic of babies getting whooping cough and dying. At that point, they came out with an adult formulation of whooping cough. It's attached to the tetanus vaccine. You need that one time. The reason we need it is because prior to them coming out with this Tdap, which is what it's called, the last tetanus shot that you got with whooping cough in it was when you were 5 years old. So we thought all those years that it was just giving us long-lasting immunity, and it turned out that the adults with no symptoms were passing on whooping cough to infants who couldn't fight it off. So that's where we got the Tdap vaccine, but you just need one as an adult so far. We also recommend the flu shot every year. I could debate you guys about it, but I'm not going to. I just recommend it. Get it. Yes, sir.
No, sir. It's not a debate. It's to really share with people that the older you get, your immune system goes down.
Yeah.
And we should not fight the flu shot.
So here's the thing. This is what I hear the most, and especially now that I'm at the VA. Last time I got the flu shot, I got the flu. I mean, every single time. First of all, the flu shot changes every year. So that argument's a little bit invalid because it's not the same shot. Okay? What they do is they try to predict what the strains are going to be for that year, and they formulate a shot that encompasses those. It's not always perfect. I think a couple of years ago it was only 33% effective, but that was 33% more than zero. So it was still worth it. I didn't get the flu shot regularly until I had kids and a husband. And I didn't, and my only reason is because I don't like shots. I do not like needles. I don't want anyone poking me. And that was my only reason. But I also work in a field where I have the potential to bring stuff home to my family. And so I started getting the flu shot every year, and I don't think I've missed a year. The pneumonia vaccine is out there. There is a pneumonia vaccine. There's actually 2 of them. One of them we've been giving to babies for years. It's called Prevnar. That protects against 13 different types of pneumonia. The other one we've been giving to adults over age 65 or adults who have chronic lung disease or kidney disease, or if you have some kind of indication for it, that one protects against 23 different types of pneumonia. So 23 plus 13 is 36. So the 13 one, they recently started giving to adults as well. It is not recommended as strongly as the 23 one, but it's out there. There's also the shingles vaccine that you get after age 50. If you ever had the chicken pox, then that virus does not leave your body. It goes to sleep in the nerve endings. When it's awakened, you get shingles. The things that can cause shingles outbreaks are immunocompromised conditions. So when it comes back out, it doesn't come in the same way as it did for chickenpox, which could be all over your body. Shingles is concentrated on wherever that nerve ending was going. Okay? So if your chickenpox vaccine went to sleep, in your neck area, the nerves to your neck go to your upper extremity. So you might get some spots or sores on your arm. Okay? So there's a vaccine for that, shingles. There's a vaccine called HPV, human papilloma virus. We start offering that to teenagers. It has been shown to have some effect in preventing cervical cancer in women. So we offer that as well. And children and teens have a bunch of vaccines. And what I want to say about that is, just think about the last time you saw somebody with polio. It's because it's virtually eradicated, except for the anti-vaxxers. It's virtually eradicated in this country because of vaccines. I had the measles, I had the mumps, I had the German measles. That vaccine came out when I was 4 or 5 or something like that. But kids don't get those diseases anymore because they have it. They have the vaccine. And I just want to point out chickenpox, because everyone thinks that chickenpox is harmless. I've already told you about shingles. But chickenpox, I look at it differently, because when I was a 3rd-year medical student on a neurology rotation, I saw a 3-year-old who got chickenpox and had a stroke. A stroke. And from that moment on, I said, this is not a harmless disease. He was just one person, but it was just that one that was good enough to change me. And let me say, I pushed chickenpox a little bit harder. And since we're talking about vaccines, and we're in 2021,
Yes.
and we're in a pandemic, and there's a vaccine out there, COVID vaccine. Right now it's for age 12 and up. Okay, it got approved Wednesday for ages 12 to 15. Guess when my kids got theirs? Thursday morning. They got vaccine number 1. Okay. We are fully vaccinated. Fully vaccinated means that if you got the 2-dose series, 2 weeks after your second dose. If you got that 1 dose of Johnson & Johnson, 2 weeks after that dose, okay? When the vaccine was not out yet, they were doing surveys about would you get the vaccine if it was available. And 60% of Americans said they would get the vaccine. 42% of Black Americans said they would get the vaccine. 83% of Asian, 63% of Latinx. It distresses me a little because the people with the lowest numbers are the ones who have the highest numbers of COVID infection and the highest morbidity and mortality. So we are more likely to die from COVID than the people who said they would get the vaccine. So if you have the opportunity, get it. Which one should you get? The one that's available. Just get it, okay? Now, just because you have the vaccine does not mean you won't get COVID. Okay, I need to say that again. You can still get COVID-19 even though you had the vaccine. But you should not have severe illness. You won't end up in the ICU on a ventilator. You won't be at risk of death. So there's no vaccine that's 100% effective. Even the ones, those childhood vaccines, there's nothing that's 100% effective. And when you hear they developed it too quickly argument, just know that coronavirus number 19 is new. There's been coronaviruses around for years and years. And there's people who have been studying these viruses for years. So they were able to focus their study on this particular virulent variant of coronavirus in order to develop the vaccine. And I'll say, as far as side effects from the vaccine, you might get pain in your arm, it might get red or swollen. People tend to be tired after that second dose. Headaches, some muscle pain, you might get fevers and chills. That should be over like 24 to 48 hours. I have friends who got COVID infection, not bad enough to be in the hospital, but bad enough to have to stay at home. And 90 days later, they're still feeling tired. They still have what they're calling brain fog. They are not the same. So I would say the lesser of the evils is the vaccine. And I wouldn't even call it an evil. I think that it's a great thing, and glad to have had the opportunity to get one.
Will there not be a time where there's better things other than getting needles shot in you?
I would say there probably will be a time. I think that right now, because we're so ready to go back to normal, that they're going to take the road of least resistance, which is a needle. I can also say that I did not feel the needle poke at all on either time. Yeah, so the person that gave it to me was really good, and she said, I'm done. And I was like, oh, okay. So that's an option. But there are some vaccines that are not needles. So, yeah. All right, so we'll just talk briefly about screenings, okay? Heart disease. I've touched on it a couple of times because I have to. Because like I said, it's the #1 killer in this country. So when you go to your doctor's appointment, usually for the physical, you'll get screened for heart disease, the screening through the family history, the screening through the social history about tobacco use, and then lab work. And what they're really checking is, do you have high cholesterol and do you have diabetes? Or do you have a risk for developing diabetes? Screening for cancers includes the pap smear that women get. It is not every year anymore, no matter what you're used to. I know it used to be every year, but things have evolved. And they have found that if you check for the cancer cells, which is the pap smear, and you check for that virus that I just talked about, human papilloma virus, if both of those are negative, you can go 3 to 5 years without getting the exam again. Mammogram, I still recommend every year, even though the current recommendation is every 2 years. Prostate-specific antigen, that is for men. Men have prostates. Prostate cancer is prevalent in the African American community. I would start that at age 45, and that's just a blood test. That's all it is. Colonoscopy checks for colon cancer. That starts at age 50. Earlier if you have a family history, which goes back to why we ask family history. And if you had a smoking history, then we'll get a CAT scan of your lungs. The only other thing that we screen for that's not up there on the screen is depression. Usually a screening for depression is just 2 questions. 2 questions. Over the last 2 weeks, how often have you had little or no interest or pleasure in doing things? That's question 1. Over the last 2 weeks, how often have you felt down, depressed, or hopeless? That's question 2. So you got not at all, several days, more than half the days, nearly every day. Basically, if you have several days on both of them, then it's positive and it warrants just further digging, okay? 3 or more means that depression is likely. So it's important to ask because people aren't gonna volunteer it, and some people think that it's normal. You know, this is just the way I am, this is normal. Lifestyle modifications, diet, exercise, sleep, emotional well-being. You know, there's general rules of thumb. How much water should I drink? I tell my kids, and this is the way I do it, is I drink half my body weight in ounces. So I'm not going to tell you how much that is. But you can calculate it for yourself, you know, see how much you weigh in pounds, cut it in half, and that's how many ounces you should drink. I think the guideline is 3.7 liters for men and 2.7 liters for women. Why is men more than women? You know, I'm not sure. Half your body weight in ounces works really well, okay? Exercise is the 30 minutes a day, 5 days a week. That's how we divide it up. Really, they're saying 150 minutes a week of moderate intensity aerobic activity. So if you're doing something that's high intensity, you can get away with less time, but 150 minutes a week. So how do you get started if you're not exercising at all? You don't try to do 30 minutes a day, 5 days a week. You just know that you set a reachable goal, and you know that any movement is better than no movement. Amen. Okay? If we talk about diet, and I think at a future time I'll talk a little bit more about diet, but half your plate should be fruits and vegetables. The next quarter should be protein. The next quarter should be your carb. And that's it. So, closing the visit. So we went through all this at this doctor's visit. So what I call hand on the doorknob questions, don't do this. If you had some burning question or something you wanted the doctor to ask, present it to him in the beginning, okay? Because inevitably we'll be on the doorknob saying, okay, we'll see you in 3 months or 6 months. And you say, oh, by the way, doctor, I have blood in my stool. Or, you know, something that makes us go, oh my gosh, now we got to go back and revisit. So try not to. And while you're sharing what the thing is that your heart's desire, or the burning thing that you want addressed, you also need to keep in mind, do you have financial obstacles? Is this doctor asking you to do something that you know you won't be able to afford? Is your copay going to be too high to see that specialist? Those are the things that you have to share, which goes back to the relationship. You have to share it so that an alternative can be sought. Or is there an assistance program? Is there a place where you can go that costs less? So sometimes you have to share things that aren't directly related to the symptoms that you're feeling, but will have an impact. I recommend that you request clarification anytime somebody is telling you something, especially if the language is complex. Then you ask for clarification over and over again until it's clear to you. And then just know with medical record access, which is available now, you can go into these e-charts and you can pull up all of your records. Just know that everything's not important. Sometimes the doctor didn't tell you about that high MCHC on your blood count because it's not something we look at and it doesn't mean anything. But what happens is people get with their record and they get with Dr. Google and they start diagnosing themselves and work themselves into a tizzy over something that really is not relevant.
Right.
So I'm not saying don't ask questions. You can say, what is this thing? Okay. But if they're telling you it's not relevant, they shouldn't be lying to you. I wouldn't be lying to you if you were telling me. Okay? And that is it for me. And if you have any questions that I can answer, I would be glad to.
Why do African Americans have everything so negative?
Pardon me?
Why do African Americans have everything so negative?
There are those who would say it's our diet. I don't think that that's it. I would say that socioeconomically in this country, we tend to live in lower socioeconomic status than other people. So that means our neighborhoods don't have grocery stores. It means if they do have grocery stores, the fresh fruit and vegetables cost more than the soda.
Wow.
And so if you're on a fixed income and you need to get something for your family to eat, you're going to get what you can afford. So a lot of it is diet related, but it's related to the circumstances. Okay.
Okay, I have a question.
Yes.
With the COVID situation, I know someone was telling me that if you have COVID and it was saying that you couldn't get it, I don't know, if that's true or not.
I don't think it's true. I've actually seen cases of people who got it a second time. And it was not necessarily a less severe illness getting it a second time, which is why I would recommend the vaccine. You can get COVID whether you're vaccinated or not, and you can get it a second time. That's why we're wearing masks, okay? I know the CDC recently has said, you know, if you're around people, everyone is vaccinated and fully vaccinated, you can go without masks inside and out. I'm still going to be wearing my mask until we could at least get closer to herd immunity, and that requires everyone telling their friends to go get the vaccine or taking their kids to go get the vaccine. We don't have any control over the kids under 12 because there's no vaccine that's approved for them yet. But if we could get from 12 to seniors all vaccinated, I think that we could feel more comfortable. Yes, ma'am.
That kind of the first question to ask. Okay, I know like in the African American people in us, arthritis is very prevalent. So is that like due to bad eating or?
So arthritis is wear and tear, okay? So I'm 57 almost. So I've been using the same spine, the same knees, the same elbows, the same hands for 57 years. If I'm carrying extra weight, then I'm putting more stress on those same joints. And that's where arthritis comes from. Now, if I was athlete and I was running track, then I'm putting even more wear and tear on my knees or something like that. So I don't think I've seen the data to say that it's prevalent with African Americans more so than someone else, but it's prevalent as your age gets higher. Everybody has a little bit of arthritis. Yes.
Could it also be the type of work that we do?
Yep.
Because a lot of times we don't see upper level positions, so we're kind of at the lower end of the spectrum, which is more physical labor.
Yes.
And so then someone can just assume, and the reason I say that, I would share with us, if you have time, share with us about bad information. And the internet is not always true. And misinformation that, people will, well, it only lasts 6 months. Our community is easy to fool and hard to learn.
Yes.
And we have people like you, and I'm ecstatic for you. I am excited for you sharing this with us, that we can help not only the local community, but the global community, that a lot of times people give you misinformation on purpose.
Well, yes, and I mean, you've said it, so I just piggyback off of that. Definitely all information is not good information, and TikTok and Wikipedia are not valid news sources. They're not researched. I would just say, if you have a trusted person, and y'all have a trusted person because you have me.
Amen.
If you have a trusted person, ask them and get verification and get a second opinion. Even with your doctor, get a second opinion. If they're offended that you're asking for a second opinion, there's a problem. There's a problem. So,
Really bad hearing granule.
yeah.
And they really like for you to get second opinions and any of that, and they'll tell you that.
Well, that sounds like they have a problem with their security,
I've been told that before.
Yeah. Yeah, just say, oh, well, I got a niece who is a doctor.
I just say, I got insurance,
Yeah.
they let me go where I want to.
Yep.
I got insurance, I ain't paying, insurance paying you, and they don't pay somebody else, I got insurance.
And
And I walk out his office.
that's right. Well, see, but you're blessed, because if you have HMO insurance, and I didn't want to go deep into insurance, but if you have HMO insurance, you have to go through a gatekeeper.
Okay.
So the primary care doctor gets to direct whether you get to see somebody else.
Wow.
And so that's why you got to get the relationship. You got to get the right one. So you're blessed to have the kind of insurance where you can go to somebody without somebody directing you there. So. Yes.
For older adults, how important is a multivitamin, or could stop you taking daily multivitamin?
If you have a balanced diet, you don't need a multivitamin. But not many people have a balanced diet. So the way I usually say it is, it's not doing you any harm to take a multivitamin every day. I can't remember to take one every day. And I'm an older adult too, so.
So the best thing we can do is to practice eating better.
We could, and there's probably ways where we can do this together and figure out ways to, meal plan or eat healthily. So, all right. All right, so I'm turning it over to the folks that do this regularly.